talk about like personality disorders as like a set of diagnoses, and what does it mean to have a personality disorder?
Sure. So yes, there are so many more personality disorders. I think, maybe like 10, I think is the number in total, and they're grouped into clusters. So there's the dramatic or erratic cluster. And that would be the ones that we hear most about: narcissistic personality disorder, borderline personality disorder, and then antisocial personality disorder fits into that. Then there's odd eccentric, and that would be schizoid, schizotypal, and paranoid. And then the third category would be anxious or fearful, and that would be avoidant personality disorder, dependent, and obsessive compulsive personality disorder, which is different from obsessive compulsive disorder. The thing about personality disorders is, and I think this is kind of one thing that's generally misunderstood in the proliferation of information online about personality disorders, and that is we all have personality traits, but we don't all have disorders. So when you look at the Diagnostic and Statistical Manual of Mental Disorders and look at the criteria for the various disorders, anyone can have any of those as single traits. So let's say with borderline personality disorder, if one of them is difficulty with your self identity, or emotional dysregulation. Anyone can have those, but it doesn't have to mean you have that disorder. So with the disorders, you have a collection of the traits that also cause dysfunction or problems in all aspects of your life: relationships, your work, and it may even affect you personally as well. So there's a threshold of these traits that pile on that then cause problems for you. One of the problems, unfortunately, with personality disorders is that often people don't have enough self awareness to see themselves as having a disorder. There's a tendency to do what we call externalize blame. So you see the problem as your environment, other people, and it's not you. So you may not always be able, you probably can't just diagnose yourself with a personality disorder. And in fact, there's another thing, another little pet peeve I have about hearing things online and then wanting to diagnose other people as being a certain disorder. We learned in my training that we usually don't diagnose a personality disorder with the first evaluation, because you're looking for longitudinal information, which is information that stretches a span of time. So how are you acting, or what was going on in your late childhood and in adulthood, over years, and not just this kind of one slice in time. So as far as what is or how do you have a personality, or how it develops, going back to this kind of diagnostic question here, there's no one thing that causes personality disorders. It's a combination of the classic terminology that people will say, nature versus nurture. So the nature part would be what you come into this world with, genetics, your temperament, and then nurture would be your environment and the effect it had on you. So early experiences, how well you bonded and attached growing up, or as you were being raised as a child, any trauma experiences, like all of those things can intervene and kind of lead you down the road of a disordered personality, because we all have personality. And then last bit about personality disorders and how they come about when they develop, they typically show themselves in late adolescence to early adulthood. That's when things start coming together enough to be able to see, is this someone with a personality disorder or just various aspects of different personality traits?
So, Dr. Marks, would you say that a personality disorder is something that could develop after like one singular traumatic event, or is it typically like a longer standing pattern of behavior and circumstances that would lead to a personality disorder?
It's the latter. It's not just one hit and then now you're impaired for life with this personality disorder. It's a series of things and experiences and reactions that you have that come together to result in a personality disorder. Again, I keep emphasizing that disordered part because we all have personalities. The presence of aspects of different personalities does not mean you are disordered. And disordered, equals pathology. So not everything is pathology. That said, with something like complex PTSD versus regular PTSD, if you will, is, first of all, complex PTSD is a construct. It's not a diagnosis or official diagnosis like PTSD. But complex PTSD is thought to develop from multiple traumatic events, kind of like little hits, and they're not necessarily little, but like, 1,000 stabs over time that start in your younger developmental years, such that it kind of the experience itself and your reaction to it kind of infuses itself into your personality makeup, therefore potentially leading to a personality or a disordered personality as you get older.
And what would you say? You've already kind of talked about like one of the hallmark characteristics of personality disorders is this like lack of insight and like ability to see yourself maybe as others do. Can you talk about why that is kind of a hallmark of this cluster of disorders?
Okay, I'm get a little bit heavy here with the kind of ego psychology here a minute. I'm sure you're fine with this, but I just want to warn the audience a minute. So, but there's a concept called something that is ego-syntonic versus ego-dystonic. Ego-syntonic would be something or things that um, kind of go along with how you see yourself, how you feel, how you view yourself, such that you don't see it as a problem. Ego dystonic would be something or behaviors or experiences that go against how you see yourself. So an example of this would be psychiatric disorders like depression and anxiety. The experiences that you have are different from how you see yourself. You know you have a problem because you are different, versus with personalities tend to be ego-syntonic. You don't see that you have a problem because it's built into your nature, or it's built into how you view the world. So for you, this is how things should be, and other people who don't like it, they're the ones with the problem. So another way to phrase that or to see that is having lack of insight, that you don't see that you have a problem. And one of the results of this, or what can happen, is that often people with personality disorders don't come to treatment because of their personality disorder. They come to treatment either because they have something else like depression, anxiety, something that's ego dystonic that's causing problems for them that they see as a problem, or they come because a partner says, you either do this or I'm gone. But they normally don't just kind of walk into therapy saying, I've got histrionic personality disorder and I want you to help me with that. It takes a lot of self-awareness. And chances are, if they did say that, they've already had therapy to see that that's what their problem is.
And I know this was different across disorders, different probably across the clusters, but what does treatment planning and a treatment process typically look like to help somebody who does have a personality disorder?
So I know that at this point, there are lots of different therapy modalities, many of which I'm not familiar with. When I trained in New York City. It was very psychoanalytical. A lot of my supervisor were analysts. And so it was very heavy into psychoanalysis and psychodynamic psychotherapy. So the approach to personality disorders was helping someone have insight. And that is kind of my orientation when trying to help someone with this. And that's not necessarily analysis, by the way, but just kind of insight-oriented psychotherapy. And the approach with that would be kind of from a high level view, would be helping someone see what they don't see. So we all have blind spots, and seeing patterns and trying to understand why you have certain reactions. So let's just say, let's take an extreme example. If I believe that people who are stupid deserve to be punished or deserve to be criticized because they're stupid. Okay, I can live believing that, but if I go out into the world and have a job or have relationships, somewhere along the line there's going to be a big old rub with me with that bad attitude. But I don't see it as a bad attitude. I just see it as it just makes sense. So if I go into therapy, or if I had a patient who believed that, I would try and help them see how that belief causes problems for the people that they're around as well as for themselves. Because in that scenario, I'm the person who believes that. I may not care that other people are insulted. There has to be something in it for me to feel like I need to change because of that. So what could that be? That could be me not seeming to get promoted, and I can't understand why, or never being made a manager, or my partner being mad at me all the time. Like, why? So, I as a therapist would help try and bring those examples in, and then try and help deconstruct what causes people to have these kinds of reactions. Oh, what do you know? It's because this is what you think, like helping them try and discover their flawed thinking.